Today, I'm speaking as your ally, not from an ivory tower, but from countless nights in emergency rooms, family conversations in ICU corners, and the quiet triumphs of recovery clinics. The goal of this episode is simple: to hand you a set of reflexes, awareness, posture, and breath that can bridge the minutes between first symptoms and the arrival of medical help. Those minutes matter more than most people realize. Why you should keep watching. You'll learn the subtle, often missed warning signals that can precede a stroke by minutes or vanish in 60 seconds. You'll practice a simple, evidence-informed stabilization routine: ground, elevate, breathe, that may preserve perfusion to the brain while waiting for paramedics. You'll hear real patient stories, the kind that change how families respond when seconds count. You'll leave with a 7-day rehearsal plan, a prevention blueprint, and a recovery mindset grounded in neuroplasticity. Part 1. The moment that starts quietly. Recognizing the brain's loud whisper. Most people picture stroke as a dramatic collapse. Sometimes it is. Often, it begins as a quiet glitch in the brain's circuitry. Signals you must not ignore. Sudden numbness or weakness in the face, arm, or leg, especially on one side. Sudden trouble speaking, finding words, or understanding speech. Sudden vision trouble in one or both eyes, or a sudden curtain of darkness. Sudden dizziness, loss of balance or coordination, or a severe, unusual headache. Brief symptoms that vanish within minutes. Why fleeting symptoms matter. When a clot brushes by a cerebral artery or briefly narrows it, symptoms can appear and disappear. That is not safety. It's a countdown. Dismissing these signs is like hearing a smoke alarm chirp and removing the battery. The time truth. We often say, time is brain. A more practical phrase for families is this: every minute you wait is a neighborhood of brain cells you might lose. A quick bedside test anyone can do. FAST plus B. Face. Ask for a smile. One side droops. Arms. Raise both arms. Does one drift? Speech. Repeat a simple phrase. Slurred or wrong words. Time. Note the first moment of symptoms. Balance. Sudden unsteadiness or leaning. Eyes. Sudden vision changes or double vision. If any are positive, treat it as an emergency. Call right away. Part 2. The physiology in plain language. Why posture and breath matter. Think of the brain as a city powered by a dense electrical grid. Blood is the power line. A clot is a fallen tree on that line. The brain has some backup routes, collateral vessels, but they're narrow and easily overwhelmed. In the early phase of blood flow reduction, small changes in systemic circulation can modestly support these backup routes. What helps in the first minutes? Keeping blood returning to the central circulation, venous return. Avoiding sudden drops in blood pressure. Maintaining oxygenation and a calm respiratory pattern. Preventing falls or secondary injury. What hurts in the first minutes? Panic hyperventilation, which can constrict cerebral vessels. Standing, walking, or driving yourself to the hospital. Delaying the call for help to see if it passes. Taking medications not advised by your doctor in emergencies. For example, suddenly taking a blood thinner without instruction. Part 3. The circulation support routine. Ground, elevate, breathe. This is not a cure, it's a bridge. It buys time while help arrives. Safety first. If you're alone and can do so safely, unlock your door and call emergency services immediately on speaker. If you're with someone, have them call at once. Note the exact onset time and bring medications list. Step by step. Ground sit or lie down immediately to prevent falls. Ideally lie supine, flat on your back, on a firm surface. Loosen tight clothing. Avoid compressing the neck. Elevate if you can breathe comfortably and have no known contraindications. Gently elevate the legs about a foot. a pillow, folded blanket, or ottoman. This can increase venous return toward the chest and potentially support cerebral perfusion. Do not elevate the legs if it worsens your breathing, causes chest discomfort, or if there's suspected trauma. Breathe inhale through the nose for 4 seconds. Pause gently for 2 seconds. Exhale through pursed lips for 6 seconds. Repeat. Keep shoulders relaxed. Aim for calm, rhythmic breathing. If you feel lightheaded while breathing slowly, shorten the exhale slightly, but keep the rhythm smooth. Be still and observe. Avoid talking unnecessarily. Conserve breath. Note any progression, increased weakness, vision change, new headache, chest pain. Share these with paramedics on arrival. Prepare for EMS. Keep a visible list of medications, allergies, and medical history. If you use anticoagulants or antiplatelets, tell EMS immediately. Don't eat or drink while awaiting help. Why these steps can help. Leg elevation may improve venous return and central blood volume transiently. Slow breathing supports oxygenation and dampens the sympathetic surge that can destabilize blood pressure and narrow cerebral vessels via hypocapnia. Lying flat can help maintain cerebral perfusion. In some cases, slight head elevation, 15-30 degrees, is used for patients with elevated intracranial pressure or aspiration risk. In a suspected stroke at home, prioritize safety and the protocol you and your clinician have discussed. When uncertain, flat with legs modestly elevated can be reasonable if breathing remains comfortable. Caveats and special cases. If someone is vomiting, has altered consciousness, or cannot protect the airway, roll gently into the recovery position on the side and avoid leg elevation. If chest pain or severe shortness of breath occurs, stop leg elevation and prioritize airway, breathing, and EMS instructions. If symptoms began during a suspected irregular heart rhythm or after trauma, avoid aggressive repositioning and await EMS guidance. Part 4. Stories that change reflexes. 3 windows into real life. Story 1. The breakfast table. A 72-year-old man freezes mid-reach. A sentence unravels into a slur. His wife thinks choking, but he taps the table twice. Their pre-agreed signal. He lies back on the kitchen rug. She elevates his calves on a cushion, and they both breathe. 4 in, 2 hold, 6 out. She calls for help, reads the time off the microwave clock. By the time paramedics arrive, he's clearer, answering yes, no. Imaging later shows an ischemic event that likely would have been worse without early stabilization and speed to treatment. The lesson: rehearse a family plan. The brain likes rehearsal. Story 2. The forgotten driveway. A retired teacher feels her right foot float as she steps out of the car. The car door feels heavy. She almost waves it off. Her neighbor notices she's using the wrong word for mailbox. They sit her down on the porch bench, feet up on a garden stool, and breathe slowly together. The neighbor calls for help and notes the time. A transient episode, then a clear scan, then a conversation with her doctor about risk factors and prevention. The lesson: the first witness is often the hero. Train your neighbors. Story 3. The gym misinterpretation. A 68-year-old man at a community center feels dizziness while seated between sets, not after standing. He assumes dehydration. A friend recognizes slurred phrasing and a facial droop. They do not let him drive. 911. Supine position, gentle leg elevation, calm breathing, medication list ready. He meets the window for advanced therapy. The lesson: dizziness while seated with language or facial changes is a red flag. Sit. Stabilize, call. Part 5. Practice makes protection. The 7-day stroke reflex drill we train for fire drills. Train this too. Muscle memory is your ally. Materials, a timer, a pillow, a note card with emergency info, your phone. Daily 3-minute drill. Day 1. Recognize. Stand near a chair. Say out loud, face, arms, speech, time, balance, eyes. Point to your phone. Practice hitting speaker. Read aloud the emergency script on your note card. Possible stroke symptoms. Onset time, say current time. Address is your address. Day 2. Ground. Practice sitting, then lying supine smoothly. Position a pillow to elevate calves approximately 12 inches. Rehearse calm breathing. In 4, hold 2, out 6. Do 5 cycles. Day 3. Fetch and place. Put your medication list, allergies, and ID in a visible place near the entrance. Practice telling an imaginary paramedic. Medications include: I take a blood thinner. No known drug allergies. Day 4. Partner drill. If you live with someone, trade roles. One calls, one stabilizes. Use clear commands. You breathe with me, I'll call. Time started at 8:12. Day 5. Solo drill. Simulate being alone. Unlock the door. Put the phone on speaker. Lie down. Elevate legs. Breathe. Day 6. Neighbor alert. Tell a trusted neighbor the plan, the code phrase, I may say bench time, call 911, and where the spare key is. Day 7. Randomize. Set a random alarm. Wherever you are in the house, perform the drill safely from there. Part 6. Prevention as a daily ritual. Keep the brain floodlit. Morning activation, the 3-minute reset. 3 slow breaths upon waking. 1 minute of calf pumps while seated at the bed's edge. Heels up, toes up, steady rhythm. Gentle neck and shoulder circles. Drink a glass of warm water before caffeine. Why it matters. Calf pumps activate the soleus muscles, supporting venous return. Gentle breathing and hydration reduce morning blood pressure surges that can strain fragile vessels. Movement through the day. Walk most days. 2 brisk 10-15-minute walks can be as effective as a single longer session. Add slow, rhythmic resistance. Sit to stand repetitions, light band pulls, supported heel raises. Balance practice. Tandem stance near a counter. Single leg stance with fingertip support. Slow head turns while fixed gaze focusing on a letter on the wall. Blood pressure mastery. Home readings. Morning and evening for 2 weeks, then weekly. Bring the log to your clinician. Targets should be individualized. For many older adults, roughly 120-130 systolic is reasonable, but your clinician may tailor based on comorbidities. Salt awareness, steady hydration, and medication adherence are quiet superpowers. Heart rhythm vigilance, irregular pulse, palpitations. Talk to your clinician about screening for atrial fibrillation. Consider a validated home blood pressure cuff that flags irregular heartbeat or periodic wearable ECG checks if recommended. Nutrition that favors fluidity. Emphasize omega-3 sources: salmon, sardines, walnuts, flax. Polyphenols, berries, olive oil, cocoa in small, dark, low-sugar forms. Nitrates from beets and leafy greens support nitric oxide and vascular flexibility. Fiber and fermented foods for metabolic and vascular health. Steady meals to avoid big glucose spikes that stress vessels. Metabolic steadiness, hemoglobin. A1C monitoring if you have diabetes or prediabetes. Gentle post-meal walks. 10 minutes can blunten glucose rise. Sleep as vascular therapy. 7-8 hours with a regular schedule. Screen for sleep apnea if you snore, have morning headaches, daytime fatigue, or witnessed apneas. Treatment reduces stroke risk. Calm as a daily dose. 5-10 minutes of breath work or quiet reflection. Music, sunlight, brief outdoor time. These improve mood and nitric oxide biology. Laughter and companionship lower sympathetic tone. Think of them as vascular vitamins, medication adherence. Take antiplatelets, anticoagulants, statins, antihypertensives exactly as prescribed. Use a weekly pill organizer and calendar alerts. Environment readiness. Keep floors uncluttered to prevent falls. Maintain visible lists, meds, allergies, emergency contacts, your hospital preference. Consider a lockbox or smart lock for EMS access if you live alone. Part 7. Recovery is not magic, it's method. Neuroplasticity in action. If a stroke occurs, recovery starts with safety and continues with steady repetition. The brain reroutes traffic when you show it where to go. The first 6 weeks. Gentle, frequent, short sessions over long, exhausting ones. Respiratory practice. 5 minutes twice daily of slow nasal breathing. Guided movement. Assisted reach and grasp. Heel slides in bed or a chair. Ankle circles. Language. Name 5 objects in a room. Read short phrases aloud. Repeat a favorite poem line by line. Visualization. Imagine moving the affected hand smoothly. Motor imagery primes real circuits. Nutrition and hydration. Protein with each meal. Colorful vegetables. Omega-3s. And attention to swallowing safety. The 6-week to 6-month arc. Increase challenge gradually. Add resistance bands. Dual task training. Count backward while stepping. Cognitive games that target memory and attention. Social engagement. Conversation groups. Choir singing for breath and speech rhythm. Track small wins. More steps. Clearer words. Steadier balance. Plot them weekly. A coaching mindset. Expect plateaus. They are processing periods, not failure. Consistency beats intensity. Most days, 20-30 minutes of focused practice. Celebrate function, not just scorecards. Tying shoes, pouring tea, sending a text. Part 7. Frequently asked questions I get from patients and families. Q. Should I take aspirin at the first sign of stroke? A. Do not take any medication in the moment unless instructed by your clinician or EMS. Some strokes are hemorrhagic. Aspirin could be harmful. Prioritize calling for help. Q. Is it safe to lie flat? A. Often yes, but comfort and airway come first. If you're short of breath or nauseated, side-lying recovery position may be safer. For suspected elevated intracranial pressure, slight head elevation is typical in clinical settings. At home, follow your clinician's guidance and EMS instructions. Q. Can breathing really change blood flow to the brain? A. Indirectly. Slow, controlled breathing can improve oxygenation and temper the stress response that destabilizes blood pressure and cerebral vessel tone. It's supportive, not a cure. Q. What if symptoms go away? A. Treat it as a warning. Seek urgent evaluation. Transient symptoms can precede a major stroke in hours to days. Q. What about driving to the hospital? A. Do not drive. Call emergency services. Pre-hospital notification accelerates treatment. Part 9. Build your stroke shield, a printable checklist. Post this on your fridge. No fast plus B. Face, arms, speech, time, balance, eyes. If symptoms start, sit or lie down immediately. Call emergency services on speaker. Note onset time, supine if safe. Gently elevate legs if comfortable. Breathe 4-6. Keep medication/allergy list ready. Do not eat, drink. Do not self-drive. After any transient episode, get evaluated the same day. Prevention daily. Morning 3-minute reset. Walk and calf pumps. Hydrate before coffee. Home BP log and rhythm awareness. Mediterranean leaning meals with omega-3s and greens. Sleep, stress reduction, and social connection. Part X. The closing you'll remember when seconds count. When blood hesitates, don't panic. breathe, stay low, and let gravity help. That sentence is not a slogan. It's a bridge, a way to protect brain cells while the world brings you help. Share this episode with the people you love. A spouse, a neighbor, the friend who lives alone, the walking group at the park. Reflexes spread through communities. Lives are saved by practiced calm, not luck. Your brain has served you for decades. Serve it back with readiness. Train the drill. Place the list. Walk each day. Eat for flow. Sleep for repair. Laugh often. Call early. And when the moment comes, and sometimes it does, you will not freeze. You will breathe, ground, and survive.